This is our project on digoxin. Our group consists of Kaylee, Connor, Sydney, Ali, and Abigail. So digoxin is a cardiac glycoside. This means it increases the force of contractility of the heart while decreasing the heart rate. It basically makes the heart pump more effectively. It also is an antidysrhythmic, which means it prevents abnormal cardiac rhythms of the heart, including AFib or ventricular tachycardia. Additionally, some brand names are Digitech, Digox, Lanoxin, Lanoxin Pediatric, and Taloxin. And for pregnancy category, it is considered category C because it crosses the placental barrier. So it's a use only if needed drug. It is indicated for patients with mild to moderate systolic heart failure and is also useful in patients who have atrial fibrillation. It also increases myocardial contraction in children who are diagnosed with heart failure as well.
All right, so the mechanism of action. So digoxin inhibits the sodium-potassium pump found in the myocardial cells of the heart. When this happens, intracellular sodium builds up in the cell, which allows for intracellular calcium to build up in the cell as well. Since calcium is such a key player involved in muscle contraction, when the levels are increased, it causes the heart to contract harder each time it does contract. This increases the amount of blood that gets pumped out of the heart with each contraction, which is called ejection fraction. Ejection fraction is a great indicator of how well the heart is functioning. Additionally, digoxin is able to affect the vagus nerve, which is connected to the SA and the AV nodes. Both of these nodes generate the electrical signal needed to begin heart contraction in the atrium and the ventricles of the heart. Since digoxin has a parasympathetic effect on these nodes, it is able to slow the overall heart rate. So drug properties of digoxin. Digoxin can be given either by mouth or if a faster onset is needed, it can be given intramuscularly or IV. The dosage amount of digoxin is typically calculated based on the patient's weight, age, and renal function. All of these factors are extremely important in calculating the dosage amount because digoxin is primarily excreted in the urine. Sometimes a loading dose of the drug is required to get to the therapeutic range that is needed. After that, most people take a maintenance dose on a daily basis. It is important to take digoxin at the same time each day since it does have a very narrow therapeutic range. Additionally, if a patient does miss a dose, it is important to teach patients that you just skip that dose and take the next dose as continued. You don't want to double up on dosage. Alrighty, so for the first NCLEX style question number 1, what variables should be taken into account when looking at what dosage should be prescribed to the patient? Select all that apply. The patient's weight, the patient's appetite, the last reported bowel movement, the patient's renal function, or the patient's age. Yeah. All right, so the right answer for this one is the patient's weight, the patient's renal function, and the patient's age.
Okay, for the lab monitoring, the digoxin has a neurotherapeutic index. The recommended serum level is between 0.5 to 1.5 nanogram per milliliter. And we also, when we do the lab monitoring, when we measure the digoxin serum level, we draw the blood at least 6 to 8 hours after the last dose. And that's going to be an essential step to do. Digoxin levels should be checked 1 week after starting the medication and then regularly afterward. Some of the adverse effects for digoxin including the CNS are confusion, weakness, mental disturbance, dizziness, and headache, including the cardiovascular. They can cause arrhythmias and heart block. For the ENT, they can cause blurred vision, difficulty reading, light flashes, and photophobia. For the GI, they may cause nausea, vomiting, diarrhea, and anorexia. Regarding the drug pharmacodynamics, the half-life for digoxin with a normal renal function for an adult, it's between 36 to 48 hours. For children's, between 18 to 36 hours. For the route, just like we said, there's two routes. There's a PO and there's an IV, and each one of them has a different onset, peak, and duration as well. So starting with the PO, the onset is from 30 to 120 minutes. The peak is 2 to 6 hours. For the duration is 3 to 4 days. That means that it stays in the system for 3 to 4 days. For the IV, the onset is from 5 to 30 minutes. The peak is 1 to 4 hours, and it has the same duration as the PO for. Drug pharmacokinetics for absorption. Digoxin is 70 to 80% absorbed in the small bowel. The bioavailability of the oral dose is between 50 to 90%. However, the oral gelatinized capsules have 100% bioavailability. Distribution, digoxin is mainly bound to albumin in the blood, and it's widely distributed to the body. A large portion is delivered to the skeletal muscle, and that is followed by the heart and the kidneys. Digoxin is also it's a lipophilic, which means it's capable of crossing the blood-brain barrier. Regarding metabolism, digoxin is primarily metabolized outside the P450 system, and it's minimally metabolized in the liver. So it's not strongly influenced by the first pass metabolism. And we always take this one into account when giving the desired dose for the patient. Excretion, the elimination of digoxin is proportional to the total dose. Following the first order kinetics, the drug is mainly excreted by the kidneys. 25 to 28% is eliminated outside the kidneys. Gender-based differences. Digoxin is associated with an increased risk of death from cardiovascular causes among females, but not among males. Digoxin is associated with a decreased risk of death from worsening heart failure among males, but not females. Since the dose is based on the body mass index, males usually receive a higher doses of digoxin compared to females. Okay, now for the NCLEX style question number 2. An instructor is teaching a nursing class about digoxin pharmacokinetics. Which of the following should the instructor include? Select all that apply. So the first one is digoxin is unable to cross the blood-brain barrier. High doses are needed to exert effect because the drug is highly metabolized in the liver. The third one is digoxin is mainly absorbed in the first part of the small intestine. And the fourth is reduced renal function, increased digoxin half-life. And the fifth is albumin-bound digoxin are primarily delivered to the heart and kidneys. You can go ahead and pause the video if needed. And here's the answer, is that digoxin is mainly absorbed in the first part of the small bowel or the small intestine. And also albumin-bound digoxin are delivered to the heart and the kidneys.
Okay, so the physiological response of digoxin is that it stimulates the vagus nerve, which leads to prolonged conduction of the SA and AV nodes. This slows the conduction and increases the refractory period in cardiac tissue. The psychological response of digoxin is that with toxicity, manic episodes can occur. This drug decreases the activity of the sodium-potassium ATPase, which increases the excitability of neurons. That increase will cause the patient to represent symptoms of mania. There are also other mental disturbances that digoxin can cause, including hallucinations, anxiety, confusion, depression, and delirium. A developmental response to digoxin is that it is contraindicated in elderly patients. This is because they are at an increased risk of digoxin toxicity. This is because kidney function declines in elderly patients, so there can be issues with the excretion of the drug. Also, there are comorbid conditions common in elderly patients, such as COPD, that can increase the risk for digoxin toxicity. From a socioeconomic aspect, digoxin is covered by most insurance companies, including Medicare, and is known to be inexpensive. Without insurance, the out-of-pocket pay is averaged to be around $70. So the third and CLEC style question is, which patient below is at most risk for developing digoxin toxicity? A 30-year-old male patient with heart failure and hyperglycemia. B, an 82-year-old male patient with atrial fibrillation and a magnesium level of 1. C, a 45-year-old female with potassium level of 4.2. And D, a 50-year-old female with a calcium level of 9. All right, and the answer is B, an 82-year-old male patient with atrial fibrillation and magnesium level of 1.
All right, going on to some health inequities. Now, there wasn't a lot or a ton of data with descriptive or accurate information. A lot of studies have not been done on digoxin, so that is an area that we can improve in. But current data does suggest that there are no health inequities specific to patients who take digoxin when it comes to race. Now, it is important to keep in mind that people of the female sex do typically have more heart attacks, and those who are African American do too. So that is something to keep in mind, even though there isn't specific data on digoxin. Patients who are over the age of 65 are at more risk for hospitalizations due to digoxin toxicity. That is mainly due to electrolyte imbalance, as you can see below. And electrolyte imbalance toxicity because their body is excreting more fluid or moving or losing more fluids to evaporation and other mechanisms. So down below it says most prevalent causes of toxicity include hypokalemia, hypomagnesemia, and hypercalcemia. As we know, the elderly population is already at an increased risk for this, and having lower levels of these needed minerals in our body can cause toxicity. Again, special populations. Right now, with current data, digoxin is not currently known to cause fetal harm when used during pregnancy or if it will affect reproductive capacity. We do only want to use it sparingly with the provider knowing that you are pregnant. There is a chance or possibility that they will discontinue it towards the end of your pregnancy terms. But in the beginning, there is no data right now that suggests that it is toxic for the unborn fetus. If taken during pregnancy, like I said, monitor for digoxin toxicity, for nausea, vomiting, diarrhea, or cardiac arrhythmias. Those are some classic signs and symptoms of toxicity, and that would include regular blood work to test for electrolyte levels and making sure our counts are where they need to be. Like I said, laboratory testing confirms digoxin appears in human milk. It is at significantly lower concentrations, so there isn't that high risk or health concerns that a provider may stay away from this. The risk of not taking it is higher than crossing over into the baby. And then just a good tip, in order for digoxin to be effective, it needs to stay within the therapeutic range of 0.5 to 2.0 nanograms per milliliter. And then a blood test with regular testing will reveal that a patient is out of range, below range, or within that range that we want. And then the classic antidote for digoxin is called digibind. Pretty easy to remember because it has the first 3 letters of digoxin. All right, NCLEX style question number 4. Question is, you start monitoring or you start your morning medication pass and have a patient who is taking digoxin for heart failure. It is 0900 hours and you're reviewing the labs from 0600 hours that same day. You see that the patient is currently in the toxic range for digoxin. You call the provider and she tells you to administer the antidote for digoxin. Which of the following is the toxic lab value and the correct antidote used for digoxin toxicity? Give you a few seconds to look over the answers. All right. And the correct answer is gonna be B, 4.6 nanograms per milliliter, and digibind. Digibind is the correct antidote for digoxin, and 4.6 is above that 2.0 nanogram threshold that we want to stay within.
As far as drug standards go, as stated earlier, digoxin has a really narrow therapeutic range. So it's important to know that when you're giving it intramuscularly, no more than 2 milliliters can be given at one time in one site. It also has an oral bioavailability of 75%, which means that 75% of the dose reaches the therapeutic site of action. As far as the nurse's responsibilities go, it is important for them to understand medication administration, including the 5 rights, understanding the side effects of the medication in order to effectively monitor your patient, and to know drug-drug interactions. Also, after taking this medications, it is important to monitor your vitals to see its efficacy of the drug. Legal regulations, digoxin is approved to treat mild to moderate systolic heart failure in adults. It can treat increasing myocardial contractility in pediatric patients, and it also helps control the resting ventricular heart rate with chronic AFib in adults. As far as clients' rights go, it is important to educate your patient on the rights that they have and on the medication they are taking, especially since they have the right to refuse. It is important for the nurse to show the benefits of the medication and the reason why the patient needs it. All right, last question. You are a nurse getting ready to administer oral digoxin to your patient who was just diagnosed with heart failure. The patient is refusing to take the medication. What is your initial response? I'll give you a couple seconds to look over the answers. And the correct answer is going to be B. A and D are kind of easy to rule out, and then the key is the question says initial response, so you want to educate before documenting. There's our references, and we're good.